So I think a wee bit about who we are in the Marie Keating Foundation. And I know Helen mentioned her mum dying from cancer at a very, very young age. And of course, Marie Keating herself died at the age of 51 from breast cancer. And back in 1998, that's where the Marie Keating Foundation started. And really it started because Marie herself was scared of hospitals, scared of doctors. She had 4 of the 5 children at home. She found a change in her breast, and out of fear she didn't go about it. And she actually had one of the most curable forms of breast cancer. So by the time she did go, the cancer had taken over, and she died at the age of 51 from a cancer she really shouldn't have died from. So we are a very small team. We do say we punch above our weight. Got our CEO over there in the corner. We've got Kathy here as well, our Director of Communications. So I'd say for a very small team, we do an awful lot, but I would say that, and I think we do. Probably could do a lot more. I think a great mention needs to come in here to the work we do in the schools. And I'm a great believer, and it's a program I manage ourselves with the Marie Keating Foundation, that if we start that conversation at a very young age, take the fear out of cancer at a very young age, give our young teens and young children the knowledge about how to check themselves, what to look out for, you know, and really give them the knowledge to say that cancer is not a death sentence anymore. We do know people still die from cancer, but we are doing a lot better. And of course, we can do a lot better. And our schools program, I'll talk a wee bit about it later. A lot of work in the travelling community that we do is through our mobile units, and we should have a picture of our new mobile unit up there. We've got 3 lovely mobile units in the south, the east and the west, and they go into the corners of Ireland that are often hard to reach, that you have more deprived communities, and that's where we really connect with the people who need us most, who often may not go to the GP or cannot get in the door to a GP. And they will come and have a private conversation with our nurses. So I won't focus too much. You'll find I read around slides. I don't read every word, put you all to sleep. But I think this is a good one to show our support services that are there for the travelling community, that are there for all communities. Like, we're all in this together. We all need to move together in reducing cancer in Ireland, and not just in, you know, certain groups, all groups. And I think that's what all our services are for, our positive living. And we have our metastatic breast cancer conference this Friday, which is a free event. And positive living is people living with cancer which has spread. I also manage our BRCA services. So when we hear a lot of a specific type of cancer in a family, that's something we may be thinking about. We have all our wonderful services there, our 221 Plus, where we work with the women impacted by the cervical scandal in Ireland. Just had our meeting last weekend in Galway, Best County, because I'm from there. I had to get that in. So yeah, we do loads of work. We have loads of support programs for people who've come out the other side of cancer, or survive and thrive, and now want to navigate that journey going back to life after cancer. So lots of stuff there for looking at, but our mission and our vision kind of are intertwined. Our vision is, and we would love to get there, probably a little bit slower with the travelling community, a world free from the fear of cancer, and really making cancer less frightening and more enlightening. So we did identify 6 strategic goals in the Marie Keating Foundation. I'm not going to go through every one, but more I'm popping it up there because the one that's applicable to our work in the community and our work with marginalised groups and ethnic minority groups is number 1. So we're really working in schools, communities, corporate, doing a lot. We have a lot more to do. Thought to show you a little picture of all our team all around the 4 corners of Ireland. Of course, I'm in the Galway picture over there with Catherine, our full-time nurse in the West, and you can see some wonderful Charlie himself with Helen, our director, our lovely new mobile unit with Carl down in the south of Ireland, and our lovely new mobile unit with Simon Harris in the middle there in the west, in the east, I should say, and then also we have our full-time nurse Sonia in the east. All our nurses are very highly qualified, they've all got master's level, and they all are very passionate about working within deprived groups and with ethnic minority groups in the travelling community. We all know this slide from the National Cancer Registry, which gives us our stats every year as to, you know, what our most common cancers are, what cancer types are we surviving. Now, this is applicable here, and you'll see later on that yes, these may be our overall most common cancer types in general, but not necessarily so for people from deprived communities. And what cancers we are surviving as a whole may not be the cancer types that people from deprived backgrounds are really surviving. Breast and prostate tend to be picked up at a later stage with lower survival rates in marginalised communities. So the report from the NCRI, the 2004-2018, the National Cancer Registry, which was a follow-on from the 2016 report, highlighted areas in Ireland where deprivation impact, cancer diagnosis, survival rates, etc. So in the more deprived parts of Ireland, cancer is higher. 7%, up to at least 7% higher for men or males, and up to at least 5% higher for females. Lower 5-year cancer survival rates are overall as well for people living in deprived backgrounds or deprived areas. Also, much higher mortality rate inside 5 years. If we look at it, 28% higher mortality rate if we adjust it for cancer types. And this then kind of correlates to the slide where we looked at the more common cancers. As you saw earlier, the more common cancer types amongst us as a whole in Ireland vary very differently to people from deprived backgrounds, where you see stomach, lung, and cervical cancer. And these are the common cancers more common in people in deprived areas. Also, the cancer types that slide earlier showed that we are surviving. These are the cancer types, breast and prostate cancer, that tend to present at a later stage where the cancers have spread in people of deprived backgrounds. And then have to bring in our ICS here, we're not just partners in running, but a new report that just came out in April this year by the European Cancer Organisation and the Irish Cancer Society highlighted the significant cancer inequalities faced by people living in the most deprived areas. So this isn't how it should be. We should be all moving together. Oh God, Marie's telling me I have 5 minutes. Okay, I've got to get into first gear here now. So looking at what we do then in the Marie Keating Foundation. So what we want is at least 25% of our reach of the people we reach in Ireland to be people in deprived areas and in marginalised communities. But this year alone, we have more than double that. So in 2024, 64% of the people that we have reached are from deprived or marginalised communities through our 3 mobile units, through our nurses. So we have a huge commitment with our nurses to do more work in the areas and with the communities that need us most. So we have on our website a wonderful social inclusion hub where you can go in and see the work that we do. And also in there you'll see all our leaflets that were brought up earlier, I think by Helen. All the leaflets that I've updated myself with Helen, our Director of Nursing, and with the primary care leads. We don't do this on our own. And with each of these bowel, cervical, ovarian and prostate, there's also in there in our social inclusion hub a video behind all of those where we went into the communities of the travelling community and spoke about these cancers and cancer types and how better can we engage with the travelling community. Lots in there as well. We do the same with Ukrainian refugees, Syrian refugees, and I think I was talking to Mary earlier, we have to give Nural a mention here, who is a huge influence and a leader in Pavey Point, and Nural helped us design this leaflet on breast, which then we actually worked with and developed for the other groups, for the Kurdish refugees, Syrian refugees, and for the Ukrainian refugees. So I want to give a quick taster, and I know I don't have much time, feedback from our nurses around the country about their work with the travelling community. And Carl down here, our New Zealand nurse who works with the travelling community down in the south of Ireland, she will say that working as a registered nurse with local community workers in the travelling community is so rewarding. Going into the heart of communities to give people time to share their personal stories is invaluable. It ensures people have ease of access and allows questions to be asked in an environment and location which is familiar. Having specifically designed pamphlets, which we have here, is essential when providing this information. No one size fits all, and that's what those pamphlets do. So I think at this quick word on call, because I want to give the rest of the ladies a little mention as well. And in our reach, we work primarily with the primary leads, who in turn go out and bring that information back to their community. Here then is some of our work that we've done only this year in the East. And I think a little quick mention of what Barbara will say, because what I will say, there's marginalised within marginalised. What we see in the East is not what we see in the West. The issues with the travelling community in the East and the South vary around the country. So I think what Catherine will say here, or Barbara will say here, I'm trying to go a mile a minute because Maria's given me the kind of keep going. She said, I have been struck by the warmth, openness and eagerness to learn amongst the health care teams or the primary care leads and the travelling community themselves. What stands out for me most is the genuine desire to understand and improve their well-being. And what Catherine and Barbara will say, because they both would work very close together in this event on the 12th of June this year, that I was apprehensive and slightly worried if the travelling community would engage with me. Now I'm overwhelmed with how lovely and engaging the travelling community are. Barbara is new to our team. So, and then again, Barbara did a lot of work she's doing in the East alone, and this is only in the last few months. And again, we reach and work with the primary care leads, and they bring this information out to their own people. And I would just point to the bottom there. Yes, there is a challenge, primarily engaging with men in the travelling community. Look how many you can see there that Anya, our nurse, reached this year, 51 females, 3 males. But out of that 54 individuals that Anya spoke with, 10 had huge issues that were recommended on to a GP. And what I will just quickly say here that Anya will say, she will say there is good awareness in general among women in the travelling community around skin cancer, signs and symptoms to look out for, dangers of sunbed. However, many women report the culture among the travelling community and the societal pressure to be tanned as a barrier to stop using sunbeds. Anya would say as well, and I'm just going to say it because under time pressure, that she felt there was good engagement with screening in the East, whereas in the West, Catherine would say quite the opposite, that actually the engagement with screening was very, very poor in the West. Catherine would say in the West as well of Ireland that she would say you had to be very sensitive around your use of the word cancer. And I think the travelling community would say that. It's still seen in many parts as a death sentence, and Catherine would find other words to use to engage with the community rather than just saying the word cancer. So I think I'm going to quickly move along, but look at this down here, and I think this is very promising. And the only is the area in green, and I will say, is the younger travelling community want to engage more with their health. And a young 19-year-old approached Catherine and reached out and asked, could Marie Keating attend her own group that she set up in the Sligo Youth Reach, as she was doing a project on skin cancer, and she really wanted to increase awareness around sunbeds. She had lost her mother to melanoma. So I think the younger generation of the travelling community are very keen to engage with us also. And as Catherine would say, it's important to be culturally appropriate and understanding. And also in discussing smoking, etc., Catherine would say she would be very careful again that in discussing smoking, bringing in lung cancer, and reducing the stigma and encourage engagement. So a quick mention in our schools program, which is a fabulous program. I think it reaches the travelling community as well, with everyone, every step of the way. I'm told I never shut up there.